We will bring our regular city council meeting to order. It is Monday, July 8th, 2013, 7 p.m. If anybody here requires special assistance participating in this public meeting, please let us know and we will try to accommodate you. Roll call, or call, well, no, we got a new one here, excuse me. Agenda item 2. We decided a couple of meetings ago to put the Pledge of Allegiance at the beginning of each meeting. And so that is what we're doing now, Pledge of Allegiance. I pledge
allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Agenda item number 3 is roll call.
Councilmember Crump.
Here.
Councilmember Johnson.
Here.
Councilmember Clark. Here. Councilmember LaFever.
Here.
And Mayor Pro Tem Couch.
Here. Agenda item number 4 is approve tonight's agenda.
The claim register is quite large again. I'd like to go over that at some point. Can we put that piece off to the end?
You want to put it to the end? Okay.
Yeah.
We can move everything but move the claims register to the end.
I'll make a
And we'll make a
motion.
motion to approve everything but, and then we'll do that at the end.
Okay, I'll make a motion to approve minutes and set a date for July 22nd.
Hold on. We are at agenda item 4,
Oh,
just
sorry.
tonight's agenda.
I'm sorry.
That's
You're right.
So I'd entertain a motion to approve tonight's agenda.
I'll make a motion to approve the agenda.
You have a
Without
second?
exception.
I'll second.
Any further comment or questions? Councilmember LaFever,
Aye.
Clark,
Aye.
Johnson,
Aye.
Crum,
Aye.
and I approve as well. So tonight's agenda has been approved. Agenda item number 5 is approved consent agenda. It's the minutes of the June 24th regular city council meeting and the June 26th special council meeting. Set date of Monday, July 22nd for the regular city council meeting. Approve claims register and cash report. And approve a building permit for Gary Irvin, 202 West 5th Street for a sidewalk.
Now I'll make a motion to approve the consent agenda minus the claim register. I want to review that before the end of the meeting. So
Okay.
we'll put that towards the end.
I'll second it.
Made myself a note so I wouldn't forget. We have a motion and a second to approve the consent agenda minus the claims register and cash report, which we'll put towards the end of the agenda. Comments, questions? Councilmember LaFever,
Aye.
Clark,
Aye.
Johnson,
Aye.
Crum,
Aye.
and I approve as well. Agenda item number 6 is approve a Class C beer, Sunday sales, carry-out native wine permit for Logan Country Store. Everything is in order.
I approve Class C beer, Sunday sales, carry-out native wine, and permit for country store.
I'll second it.
We have a motion and a second. Any comments, questions? Councilmember LaFever,
Aye.
Clark,
Aye.
Johnson, Crum.
Aye.
I approve as well. Agenda item number 6 has been approved. Agenda item number 7 is approved closing a portion of the alley between North 3rd Ave and North 4th Ave and 7th Street and 6th Street on July 27th, 2013 for Doc's Roadhouse for a fundraiser for West Harrison Special Olympics. And everything is in order. I believe there's a map that shows where it is, and I believe they've done this for a few years.
I like the documentation too. Nikki, whoever took care of that this time. Thank you. I'll make a motion that we approve closing the portion of the alley between North 3rd and 4th Avenue and 7th Street and 6th Street on the 27th for Doc's Roadhouse fundraiser for the West Harrison Special Olympics.
Okay.
I'll second that.
We have a motion and a second. Any further comment or question? Councilmember LaFever?
Aye.
Clark?
Aye.
Johnson?
Aye.
Crum?
Aye.
I approve as well. Agenda item number 7 has been approved. Agenda item number 8 is discuss and approve memorandum of understanding from the Home and Public Health. Memo of understanding, memorandum of understanding that we do. Is that correct, Marilyn?
I don't believe it's annual. It goes through 15
Okay.
through 18.
So every 5 years. In short, this MOU establishes a relationship of cooperation between the Harrison County Home and Public Health and the Logan Community Center to provide physical facilities to support personnel who are providing emergency public health services to designated populations affected by a disaster or public health emergency.
I think it looks good. I can certainly see approving something like this. I don't know if we took it to council yet to have it kind of reviewed, especially that indemnification portion number 3, I believe. That would be the only question I'd have about it. The rest of it seems to be straightforward, and we probably have one on hand that we've signed in the past.
My understanding, it is the same as we've signed in the past, just with new dates. Okay. The one you have in front of you has the 2nd day of July as it came in. We'll obviously put today's date, which would be the 8th of July.
Mike, don't we have a group that's already using the hall and special deals as far as if there's a flood or something? Doesn't the Red Cross or something use it for special deals like this already? So who takes precedence over that? Which group gets it? That's my only question.
That's a good question, and I can't answer that.
It looks like, according to this document, that they would.
I mean, that would be, they'd override every other commitment that we have on it, and like I said, it's a disaster type scenario, so.
Any and all public buildings probably be utilized at some point.
Do we know if there's any other entities in town, like a school or anything else that's also on a plan like this?
I don't know. I don't know. Would you like to have more information, Dennis?
No,
or
I'm fine with it, it's just,
right. The coordination piece.
One of my
Right.
questions, heaven forbid we have a problem and something comes up, but hopefully the two will work themselves out.
Is that any questions?
I'm fine with it.
Somebody entertain making a motion?
I'd like to have it reviewed if we can, just for that sake. I mean, even I hadn't even thought of what Benny had thought of, and I think this would trump anything we have, but I'm not aware that we have any other commitments like that where somebody might be hung out.
Are you familiar, Marilyn? Other commitments?
Red Cross was here, I think, last spring and asked for this, basically the same thing.
we probably need to look at them and then coordinate them, make sure we're not overlapping.
Yeah.
That's a good point.
Now, I do know that the Red Cross, when they made their agreement, if we had something in this building, they wouldn't use it. It was a little different with them. I don't know if you guys recall.
No,
Yeah. Because they said that if we had a commitment, that they would move for that time period.
So they were flexible, so there wasn't necessarily an emergency.
Right.
Okay.
Let's table this till the next meeting. Let's make sure we're coordinating the agreements that we have out there and not overextending ourselves. And
Okay.
so we'll go ahead and, so we will put that on the 22nd agenda. Agenda item number 9 is to appoint Randy Feder to Planning and Zoning Commission. When Randy left, he volunteered to go on the Planning and Zoning, which is short, I think, 1 or 2 people.
I talked to Randy today before I left, and he said he'd be more than willing to be on it, so.
Planning and Zoning, Jason Roden is the administrator. And then we have 3 actives and we have 2 open slots, how I read it here. We have Jill Dival-Bess, Mike Pitt, Scott Moss is on the Planning and Zoning, and we have 2 open slots or positions.
Besides putting Randy on.
Once we put Randy on, there'd be one additional.
Okay. Make a motion?
I'll make a motion to appoint Randy Feder to the Planning and Zoning Commission.
Do we have a second?
I'll second it.
We have a motion and a second to appoint Randy Feder to the Planning and Zoning Commission. That would take us from 3 to 4, and we'd have one left. Any further comments or questions? Councilmember LaFever?
Aye.
Clark?
Aye.
Johnson?
Aye.
Crum?
Aye.
I approve as well. So Randy is now on the Planning and Zoning Commission. Will you let him know that, Denny? tomorrow?
Yep.
Okay. Nick, update on the chicken ordinance.
I put this on here just to update everybody that I'm still working on it. I'm working right now to compile as many possible ordinances as I can from other cities to see what works and what I think may work. And I would entertain any ideas anybody has to try to collaborate together to, I guess, come up with the best thing we can get.
Any other comments or questions from anybody else on the council? So let's go ahead, and if you have your own thoughts, get them to Nick. Nick will, as he said, is doing the legwork and pulling it together and going to draft something for us to react to. So thank you, Nick. Agenda item number 11, Elysian Health to discuss renovation of Logan Clinic. Bob Valentine.
If I can speak loud, Good evening, Mayor Fouch and City Council members. I'm Bob Valentine. I'm the Regional Administrator at Community Memorial Hospital, and I'm here tonight to talk about our clinic here in Logan. And I have with me Dr. Mary Loeb and Dr. Carrie Grady, and Chris Yankovich would be here, but he's got a little family situation going on. What we wanted to talk to the council about is the opportunity to expand, renovate our current clinic. We have been in that clinic since, my notes say 1995. I know it's been there a little longer than 1995. It's a 2-provider facility, and we currently have 3 providers. It's one of our fastest growing clinics in all of Collegiate Health. We see a lot of patients through there. Our plan is to be here for a long, long time. We've been here for a long time and we want to stay. I know there was maybe some discussions that people thought maybe we were trying to leave, but that is furthest from the truth. What we have done in other cities, Woodbine is already in place, and we are currently in the process of signing the contracts agreements with the city of Dunlap, is working with the city to do through USDA loans to do a purchase, renovate, and expand the clinic. And long-term lease, they've been 20-year leases at the other facilities, lease to own. So we lease for 20 years and then with a buyout at the end. We have some preliminary drawings that we had explored early on when we were looking at this. We also have some preliminary costs on what it would take to get this done. I think it's a great opportunity. I know one of the questions is why doesn't Allegiant pay for this? As a big organization, we're now actually part of a large organization that's in 20 states with over 90 hospitals. Everybody fights for capital, and we've kind of, because of the things we've done with Woodbine and Dunlap, our priority to get money through Allegiant has kind of come down somewhat, so our success has kind of hurt us in a way, in that sense, if you understand what I'm saying. So they like the idea that we do these long-term leases, that it shows that commitment that we want to stay in these communities and be here for a long, long time. So we're not real high on the priority list with Allegiant to get money to do this ourselves. That's why a project like this works very well, working with the city. So that's what we want to propose. We'd love to be able to sit down and discuss more about it or provide you with whatever information you might need to maybe consider doing something like this. And we've got a lot of experience, good people that have helped out. I know Woodbine helped out Dunlap, and I'm sure Dunlap would help the city. Did I miss anything?
Can I say something?
Yeah.
So we have an old facility, it's probably now one of the oldest ones in the Legion Clinic. There's a lot more services we could offer there if we were able to get a new clinic that was upgraded. We'd like to add telehealth, which means you could see specialists from that clinic. Possibly mental health counseling from that clinic, a lot of other things we could do if we had more room. Right now, we are just so stuffed. It also.
Physical therapy.
Physical therapy. It also is not handicap accessible now, so it's tougher for some of our patients to get in, and there's just a lot of drawbacks. Right now, the country and certainly are upgrading facilities. Outpatient ambulatory care is where the future is, not hospitals, and we would like to have the nice upgraded one instead of kind of changed a lot, and the infrastructure is just not quite good enough for our needs now. It's a 2-person, there's 3 of us, and we're 3 busy people, so people are bumping into each other. So we think the opportunity actually to even grow our clinic more, in addition to offering more services there, we could actually treat more people. So this doesn't end up costing the city anything in the long term. I mean, Allegiant pays for it, it's just funded in a certain way that they accept.
And we did do, in 2010, we did about 30,000 in renovations ourselves, self-help, had our maintenance guys do most of the projects. So no labor costs, those are strictly just materials that we put into it to try to upgrade it and do some things to make it nice, new floors, painting and some new equipment, things like that. But as Dr. Loeb says, just it is kind of an aging building, and we need to address some things with it. It's a great location. We love where it's at. Just would like to expand it and renovate it.
So how many square feet do we have today, and how many are you looking at increasing it to?
I have some drawings here. Let's see, it'd be 5,500 square feet. It's an addition of 2,032 square feet. Sorry.
And considering where it sits today and the parking requirements, does it require us to potentially purchase the property behind it?
That
To the
is
east?
an option. Yeah, we looked at that. What we would have to do if we didn't do that is we would probably make it a one-way driveway through there, where you could only come in and circle through, as parking is obviously, it's a concern, but we could make it work. Our architects looked at it, and it would work, but the additional land would be a nice addition.
Would you consider other locations? Are you looking at all, or?
We would. That's certainly, we're not opposed to looking at other options.
Is there a time frame on this, a goal date, anything?
The sooner the better, no. And USDA funds are, it's really good rates right now. If you haven't looked at any of that lately, but
I'd love to talk with whoever's been working with in the other communities that have kind of been through
You bet.
this experience, so if you could give us those names or whatever.
Lisa Gross is my point of contact out in Dunlap for that project. And I know she'd be more than willing to talk to you all. And Darren Smith, Todd Heaston from Woodbine, were the main guys out in Woodbine.
Now, we as a community, it's been there, like you say, probably a few years before 1995, but
I
that's
believe
how
it was
far.
built in 1988.
Yeah, before your records, but, so we have investors that have put money in and own the building,
Correct. We lease it from them.
and you lease it from them.
Yes.
And these, what I'm hearing from some of the investors is that, they would like to, cash in their investment
Right.
and have the city buy them out, which we'd own the existing, and then go into an agreement, if this all works out, then to expand it on our nickel through this loan and then enter into a lease. So there would be one further step, or initial step is working with the local investors to go ahead and get them out of the transaction, and then it would be all city from there.
Well, you can roll this all up into the USDA loan, and then our debt service ratio pays off the entire, there's no monies that would come out of the cities. That's what's nice about this project, that we've done that with both Woodbine and Dunlap. There might be some property purchase issues there, but it could be worked.
There's been a couple of rumors about the hospital relocating.
That's correct. We purchased land a mile outside or east of Missouri Valley. We're right next to the cemetery as you're going there on Highway 30.
Oh, that's not a good sign.
Well, actually, if you think about it, you'll have a choice. You can go there, you can come to us, and take care of it.
Some quality issues.
But yes, we did buy 20 acres there. The plan is to move out that way as the city moves that way. And there's some issues from a federal with healthcare reform because of our status as a critical access hospital. We have to be a certain number of miles away from another one. And if that changes to 15 miles, we would be within that where we currently sit, and we could lose our status as a critical access hospital, which would not be good. So that moving it a mile outside of town solves that issue, plus it gets us all on one level, brand new, everything.
Is there a anticipated time frame for that?
Right now, we are on the books for 2016, and we're trying to get it moved up to 2015.
That's breaking ground. Or is
Yes.
that, yeah, right.
Yeah, in 2015, our fiscal year is, we're a July 1 fiscal year, so. Yeah. So 2014, if we get moved up to 15.
I know there's a couple, so not a rumor, it is actually fact. I know that there was maybe a rumor it would be closer to Logan, between Missouri Valley and Logan.
We had explored several land options, some closer this way. But because of floodplain issues and things, this one just was kind of an ideal spot for us, so. Anything else I could address?
You know, the clinic's been a very great addition in our community for many years, and I would hate to see us lose the clinic, obviously, and it's one of the first, I think, in this area, so it does need expanded, it does need to be updated and kept up with the times, and you know, I think it's a great opportunity for us to come together here and you know, move the community forward with something like this.
Absolutely. Okay.
Any other questions for Bob from anybody? Okay, thank you.
Thank you.
Agenda item number 12, discuss city fluoridation. And I think, Skip, you put this on. Fluoride in
I
our
did.
system.
I did, and I had I made some calls, and Scott, I may throw some questions your way, so again, if you're able to answer them, great. If not, we can take some time to look at that. The question was triggered by a note from Dr. Heave, and I'm going to give her some time if she'd like to talk as well. But I called the state on this and spoke with the gentleman about the program and what it entails, and it's primarily it's run by Iowa Department of Public Health and Health Services, and it's mainly around dental care and hygiene, as you can imagine. It has to do with cavities and dental care and so forth. And the program dates back to the early 60s, and he kind of went into the whole program where it started and the grant money that was given to communities to basically get the equipment to implement this fluoridation of municipal waters. And then from there, it's evolved into upkeep of those programs, and over time, culturally, things have changed. Opinions about fluoridation have, you know, there's been a lot of controversy back and forth about its health and benefits and so forth. And so, you know, with Dr. Heap's note and kind of inquiring on it, I wanted to just get in front of the council and have some dialogue about it. And I knew little to nothing about it when this started. So this is a new topic for me, but maybe one that is due for a review. Let's see, I wanted to make sure I got through. Yeah, there's some names and numbers and so forth that I have not checked with yet or called on that were provided by Randy Lane, again, Iowa Department of Public Health, websites, the Pew Foundation. So those I'm going to be checking into and seeing what other information we can share with everybody on this topic. I guess, Scott, the question I have for you is, you've been around since we've been doing this. Do you remember introducing it, or was it there when?
If I remember, either will tell me or, but I think when the first dentist came, Siegel, I believe he was on the council, and that's when, so it was before I started for the city. I don't know, 20, 30 years ago, maybe they started it.
Have we replaced any of the equipment, or?
No, it's very simple. We have our holding tank for the fluoride is provided by ACO. We buy the chemicals from them. They provide a tank. We have a pump, and never had a problem with the pump. 17 years I've been here, so I only pump a half a gallon a day on average. We actually there's no requirements by the DNR to add fluoride to your system. We don't have to do that. That's a
Yes, good point.
But if we do add it, then we're under DNR regulations. We have to do a certain amount of sampling and testing. We test for fluoride levels daily, in-house, and I send one sample per month to the lab from outside in the system. And other than that, so the cost is, I think fluoride is about $5.50 a gallon, using about half a gallon a day. You know, the in-house testing, we use a Spadden's reagent. I think a bottle that's $22 lasts about 2 months, maybe 3. And so a minimal cost, and a one month sample is probably $20 or something, $22 at the lab. So, you know, it's not a real high price thing. They did lower the standard was 1 part per million. They lowered that about a year ago to 0.7 parts per million.
Is that what we're doing now?
That's what we're doing now. And it'll fluctuate. We have about a 0.4
0.3 to 0.4 natural fluoride in our well water. So we're adding minimal amount to get it up to 0.7. So it used to be 0.1. The MCL, the maximum contaminant level is 4.0. So, you know, that's basically the maximum contaminant level is, it has to be that high before they consider it unhealthy or dangerous or whatever, and that's way out of reach. So that usually, you know, we'd have to have some kind of a problem before we'd be there, and then you'd have to, you know, drink a lot of water at 4.0. I know there's been some talk about, you know, maybe fluoride's not good for people. Some people say it isn't, some people say it is. It's natural in our well water to some extent, so.
Yeah, and they commented on our records, they pulled up our file and said that, yeah, you've done a great job in providing that, keeping that variability to a minimum and supplying all that. So it sounds like, you know, we've been recognized for doing that. They mentioned nationally there's a movement to relook at this at a federal level. I was kind of waiting to see where that goes and how that is, but they've relaxed. There's an anticipation that it may go down. So there seems to be a little trend and some.
Yeah, I don't know what the reasons were for their standards going down to 0.7 from 1.0, but it's, you know, it's still pretty minimal. You know, I mean, it's not a big change. And as far as adding it to the water, it's all automatic. Run its pumps when the wells do. We just fill the day tank a couple times a week, and we have to record it, you know, and we test it every day, which fluoride test takes about, you know, 3 minutes, 4 minutes, something like that to do. So it's not a big deal. So, and it is, like I said, something that I have looked into and bring to the council about not doing, since they lowered the standard. You know, we already have natural 0.4 in there anyway. You know, would save us a little bit of money, but when I got to figure it up, it's, you know, maybe $1,500 a year. You know, possibly it'd be what it'd be saving you right in that area.
Do you know how many cities in Iowa have and don't have?
I think there's a lot, but I know in some of the water classes I've been to and talking to the DNR inspectors when they come, there has been more and more that have been eliminating it. I mean, that's something that, and how to go about that, I don't know. For right now, I got enough product there to probably last me the rest of the year at the plant, and then we would have to wait until I had an updated operations permit, so that the DNR would take that out of my permit. So the operations permit is what standards, what testing and what sampling I have to do on a daily basis and a monthly basis or a yearly basis. And that's what I go by. That's kind of my rule book. And if you don't do those when you're supposed to, you're in violation and subject to a fine or whatever, you know. So they may, and I think we're up to be a new permit in 2014, sometime August or something. So if you wanted to eliminate it, we would just have to work with the DNR, get that off our permit, and they may just reprint our permit, take it out of there. I don't know. I'd have to talk to them. So.
Yeah, Randy Lane, again, the contact I talked to sounded like it was a voluntary program, both on the applying, using it, and then also on the submitting your test results and so forth. So, I mean, that was just a quick phone conversation. So.
Yeah, right. Like I said, it's up to the city whether they want to do it or not. But once you do it, then if you're adding it, then you're under DNR regulations on the testing. And they have it in your permit on what you have to do. So if we decided not to, we would have to get that out of our permit so that I wouldn't be in violation. So.
Thanks. Dr. Heath, can you take a moment?
Okay, well, thank you. And I want to make sure I say that I appreciate all the efforts to keep our water fine. This is no criticism of the people that do that. Ironically, it wasn't Dr. Siegel that started all this, it was my father. He was a physician in town since the 1950s. And although people remember him as the local doctor, he actually was a physician and a dentist and a PhD in biochemistry. And he was at Harvard as a professor of dentistry and biochemistry, and he came up with the first fluoride toothpaste. And as a show and tell thing, I just thought I'd bring this. This is the very first fluoride toothpaste ever created. Unfortunately, he didn't get the patent. It's called Child Dent. So he was the person, he believed in fluoridation because he did the original work on how teeth calcify, and those guys showed that if you looked around the country, this is before fluoridation, and you looked around the country at naturally occurring fluorides, it appeared that it strengthened the enamel in teeth and that kids and people had less cavities. Okay, that was their observation. Well, so it's kind of ironic that I'm here 60 years later suggesting we should get the heck out of our water. But here's the deal. There's a big difference between naturally occurring organic fluorides and inorganic fluorides. Multiple physicians and science moves on, and multiple physicians and scientists all over the country and Canada and around the world have been working to get it out of big cities' water systems. Calgary removed it out of their water system. Lots of Canadian cities are removing it. Only 3 nations in Europe fluoridate their water, and they were pressured by the United States government to do so. You can talk about motivation here, and I'm not trying to be a conspiracy theorist, but the truth is the Mellon Foundation funded the research that actually my father did, and at one point, after the original finding that fluoride levels were associated with decreased dental cavities, the Mellon Foundation founded a whole bunch of research to show that we can maybe benefit things by fluoridating the water. And the Mellon Foundation also were founders of Alcoa aluminum. It turns out that the fluoride that they had a problem getting rid of these sodium fluoride and fluoride silicate toxic compounds, and it really does help to sell it to cities to give it to get rid of it. It's very expensive to get rid of, and we can do it by diluting it out in our water supply. So there's a certain motivation of the research that was done, and what happened was, money and research don't always mix well, and what happened was there's a lot of research out there showing very much concern about fluoridating water, but that isn't what gets publicized. What gets publicized is about the studies that show it decreases childhood cavities, but it also increases pulp disease. So, for example, in 1977 in Kentucky, despite a fluoridation statewide mandate, preschoolers' cavity rates went from 28% in 1987 to 47% in 2001. And this is in a state that has the second highest national average of loss of teeth. So that's why it was a big deal in Kentucky. Now, the American Dental Association basically are the only people that I know pushing fluoridation, backed by big industry that wants to get rid of these compounds. And the ADA knows there's a problem because they came out within the last 2 years with a circular saying they do not recommend that that babies be given formula mixed in fluoridated water. Now the reason for that is, and the reason that they've come down in the numbers on what fluoride levels should be, is that although 1 milligram per day seemed to be about the best intake to decrease cavities, 2 milligrams and above starts giving you fluorosis, 3 milligrams for sure. And the problem is that when they fluoridated water, there really weren't a lot of other sources of fluoridation, but now we have lots of sources. We fluoridate people's teeth with the rinses in the dental chair. We fluoridate our kids with dental rinses in school, and we eat a lot more processed foods that have higher contents of fluoride. Teas, lots of teas have fluoride. We're drinking more tea. There's lots of ways we get fluoride, and also it's cheap and easy to take fluoride tablets if you believe in this. So it's not necessary to fluoridate the water if you believe in the cavity theory, which may or may not be true. It's not necessary to fluoridate the water to do it. Now, unfortunately, in medical research, we've gotten to the point where we do these big meta-analyses and we do these number crunching and then we come up with conclusions. But I tell you, science is about a smart guy looking at things the right way. And I wrote an article for WorldNet Daily that anybody can access online that goes over the stuff I'm talking about. It's called, One More Government Experiment, One More Deadly Government Experiment, Fluoride. I didn't put the title on there. But the point is that Dr. Dean Burke, who used to be he was one of the founders of the National Cancer Institute, and he was the head of the cytochemistry division for years. And Dr. Burke, after fluoridation, the 10 largest cities in America that were fluoridated. And then he also looked at he looked at control cities that were the same size that were unfluoridated, and they watched them over a number of years. And what they found is, initially, the rates of cancer in those 20 cities were identical. You watched the graph, and there was a certain rise in them. As soon as fluoridation hit those 10 cities, the rise in cancer was significant. It shot up, and there was such a separation that after 2 years, there was 35,000 excess deaths in the cities with fluoridation. And he makes this statement. This isn't me. This is the former head of the National Cancer Institute cytochemistry. He says that approximately, there's no question about the data or our particular arrangement of it. The data is from government sources, which any high school student can look up and confirm. Nearly all of the fluoridation-linked cancer deaths are found to begin at the age of about 45 and then steadily increase with age. And this is sharply different than increased cancer deaths resulting from cigarette smoking or other things. He basically said that he says there have been almost as many excess deaths associated with fluoridation as the sum total of all American military deaths since the founding of the USA in 1776. Now that's an awful burden for the pro-fluoridationists to bear if they can come to see that they've been responsible for this. The problem is, and this is my point to you, is it's unnecessary. I don't know if he's completely right. I happen to believe he is. But we shouldn't be, ethically, in my opinion, putting things in the water which could be doing bad things. And one thing we know for sure about fluoride is it's a neuroactive agent. Prozac, which everybody's heard of. Paxil, which everybody's heard of. These are all fluoride compounds. In point of fact, Charles Eliot Perkins was sent over to Germany after World War II to look at IG Farben, which is the biggest chemical conglomerate in the world. And IG Farben, by the way, who produced Zyklon B for the death camp, they also were looking at population control research, and what they had chosen was fluoride. They put fluoride in the death camp's water because it decreased fertility in women, decreased libido in men, and increased passivity of the population. I'm sure it wasn't at 1 milligram. But nevertheless, it's a neuroactive agent, is my point. The Soviets used it in their gulag. This is historical data that you can verify. I'm just saying, I don't think we should have it in our water. I think that we should allow people to make the choice. And honestly, this doesn't affect me because I have the funds to buy a reverse osmosis unit. I mean, Neil came up and put my unit in years ago, and I don't get exposed to fluoride. But if you can't afford an expensive reverse osmosis, it harms the poorest among us who can't afford the reverse osmosis unit. And there are cheaper and better ways to deal with it. I mean, we could offer people that felt that they wanted it for their children. You could offer free fluoride tablets to the few people that wanted it, probably cheaper and with less ethical risk than what you're doing now. So that's why. All right, and interestingly, after I published the article in WorldNet Daily, I got a very interesting book that anybody can read, and it's very, very well documented and footnoted about all the research. And I have to tell you, the national health, the British health system, a bunch of American organizations involved in preventive health and things have looked at all this, and they say, in fact, the NHS said, given all the controversy, we're surprised that there aren't any really good quality studies looking at this. And I mean, that's really what it says. It's very hard to find good epidemiologic studies, except the one I cited by Dr. Burke, which I think is a classic. But this guy wrote to me, Dean Murphy, who's a dentist. He's actually a graduate level dentist who's done research, and he wrote this book, The Devil's Poison, that he researched over 20 years, How Fluoride is Killing You. Very good book, and I recommend that if you have questions about this, that you refer to his book, because he's really thought this one out and has spent 15 or 20 years of his life researching it. And he's got the professional expertise to understand it. So thank you very much.
Again, I want to continue to look at it. Thank you, Dr. Eve. Appreciate it. I don't know if anybody else have any comments or thoughts on the matter at this point. Again, it's new to me, so I'm kind of just wanting to look at it and dive into it.
There's only one other thing I would ask, I guess, is, and we printed the paper as well, but I'd be interested in what the citizens or the community feels as well. Knowing, what we know here, we can publish, the paper and get more feedback from our citizens as well. So it'd be interesting. Agenda item number 13 is discuss police department items. There's a listing of them here. I had the opportunity to meet with Kyle and Justin last week and kind of went over a document that they put together. And why don't you come up and briefly go through the same document that you did for me.
Okay, the first topic on here is something that Elmer had talked about in the past. And I think he was looking towards implementing it the similar way as the city employees. I talked to Boone today, and he said that they have work phones, and we use our personal phones just because we use the recorder on it and the camera, and we have a app on there for Iowa codes and compendiums and stuff like that. So as far as the work phones, I don't even know if we have access to those, but I was never offered one, but I wouldn't use it anyways because I think they're just flip phones. And I'm not sure what you guys think about. Scott, as far as, do you guys just use your city phones? Do you have personal and city?
I don't, but I think the other guys have personal
Okay.
also, but I just have a city phone.
Okay. I didn't know what the coverage was with that, and again, that was something that Elmer had wanted on there. Okay, the second one, like Mayor Pro Tem Fauci said, me and Miller had discussed with him a lot of the transition period and what we're going into, and I think it'll be a similar process when it was myself and Chief Smith working for a while before we had a third officer. And a lot of that stuff had been cleared up on what we could do and who we had access to and how we would run with filing paperwork and stuff like that. Third on there is a step fund filing. I just needed to know the number of the STEP program and what we had left in the account, and we found that number out through Elmer, and that is taken care of, but I still would have to file for 2014 funding through the state, and Elmer had just said to go ahead and contact the state and find that out. I don't know a deadline on that or whatnot. Mr. Fauci said go ahead and take care of that as soon as possible, so that's what I'll be doing with that.
Just to interrupt, Elvin, on the, stepping back to number 2, the transition issue, so did you say you've got kind of everything transitioned, you have access to what you need, and?
Yeah, as far as myself and Miller knowing what we're doing, we've taken care of that, so.
Good.
The fourth one in here is the SHIT coverage, and like I had said before, it'll just go back to the same system that we'd use with myself and Chief Smith, and covering the day call and doing our usual night shifts. And as far as the fifth one goes into play with that, as far as since I've been here, when we went down to 2 men instead of 3, there had been compensation just for the coverage of that call time. And I don't know how you guys had figured out the number for the previous one. So that's more of...
Anyone? I'll take, from what I recall, and boy, Randy was the only other person involved with that at the time, is we basically looked at savings of that one being down to 1 officer, and we kind of divided those funds up 3 ways, the 2 remaining officers in the city, and then did a slight adjustment considering the salaries of each of those 2 employees, and kind of divided up that second 2/3, or that 2/3 between, at the time, there was Richard and Chief Smith, and Kyle and Chief Smith were the 2 occasions that I can recall doing that, implementing that stipend. I put some paper, pencil, and tried to come up with something on that. And Kyle, correct me if these numbers aren't wrong, but I think we checked these out. It was $375 we had for you at the time, and we had $500 for Elmer. I think was the split when we did it for you, and I don't think it was much different when we did it for Richard and Elmer when we were down before we hired you. Obviously, Chief Smith's a whole different, salary grade and range than the officers that we've had, that we've been short of in the past. We've never been short of chief since we've implemented a salary, because I think prior to that, you guys were hourly, or the department was an hourly wage as well, just like the other city workers. So at some point there, we switched over to salary from hourly, and that's when we implemented. Both cases were in a salary situation. So you don't have the opportunity to be compensated for the extra call time, and so that's where we came up with the proposal to do that. The numbers that I'm going to propose that I looked at was, I took the same kind of scenario. I think Miller would fall into a similar situation of being the newer officer, so $375 I thought would be appropriate. And then Kyle, as you're taking on additional duties that you have with being sergeant this time, and now obviously we're short a chief, so some of those are going to fall on you naturally as well. I was looking at $425 to $450 kind of range. So those are the numbers I want to throw out and see what others think. And I think in the past when we did that, it took us some time the first time to implement it, and we went retroactive back to when we were short the officers started to that point. Obviously, this time we're a little ahead of that curve, and it hasn't been that long, but I still propose we look at going back to the, what was the date? 24th or retirement?
28.
28th, thank you.
We have this on, I think, Skip, as discussed. I don't know if we can approve anything in this meeting, but I think we should put it on for the next council meeting to approve. What if we have the police committee work with and come back with a proposal on what we want to do? You were right, the 375 and the 500, that's exactly right. So we need to look at what yours, and I don't think they're out of line. I don't think they're out of line. But we have the cell phone allowance and the stipend we're talking about. I'll have Kyle here talk about the car here in a minute, and then the ammo, these requests, the ammunition, the ammo, and what I'd like to see is the police committee get together, take all these in consideration, come back and say, here's a proposal, approve, let's discuss and approve for next council meeting, and then get it done. And I'm going to keep Kyle talking here about the other two items.
And some of these items are not top priority. I just kind of want to get them on paper and make sure you guys are knowledgeable of what I thought we might be lacking as far as we get in here with the vehicle and our ammunition count. But some of those things I understand with funds might have to wait to a later date. Number 6 is, and this is while Chief was here as well, we had some issues with viewing our squad car camera footage through the L3 mobile vision. And again, that had been cleared up with myself and Mr. Fouch. He said we'd go ahead and contact them and have them send out a computer tech to fix the problem. So that one's taken care of. Number 7 here, I have some quotes for possible a new vehicle. I talked to the police committee a little bit about this as well. The Explorer, the 2005 Ford Explorer, it's about 8.5 years old and it's having some mechanical issues. And I've been talking to Mr. Shealy about some of that stuff. And the mileage on it is quite a bit over the average of what vehicles are usually traded in at. And with winter coming on, I wouldn't like to have our only 4-wheel drive vehicle go down, so that's why I had brought this on here. And did you give your? Okay. After I'm done talking here, I'll give you guys all the paperwork I have on all the quotes on. We got it through Sid Dillon and Woodhouse. And we did it on 3 different vehicles, the Ford F-150, Chevy Silverado, and the Dodge Ram. And the reason we went with trucks instead of SUVs is price-wise, they're much cheaper. As far as getting the vehicle outfitted with the gear, there's a company called Electronic Engineering out of Omaha. It's what the Omaha PD and Council Bluffs uses to outfit their vehicles with light bars or whatever. As far as a lot of the stuff in the Explorer will transfer over as far as the radio and stuff like that. So the cost on that, again, is incorporated in here. I got some quotes from them today, so I'll pass those out as well. Do you guys have any questions about that, or just I don't know if you guys have seen the quotes or not. I know, Mr. Fowles, you haven't looked at them yet. Okay.
We've got them. Were those vehicles single cab, double door?
They're the 4-door vehicles. We're not putting a cage in them, but we would need it to be a 4-door for transporting prisoners.
Okay. So it would give us that same capability?
Yes.
Okay.
And the last one, this came to my attention with Officer Miller. He was never supplied duty ammunition, and he just had target rounds. That's something that I'm not sure if had been maybe relayed over to Chief like it should have been. That's something that, again, in the near future here, we're very low compared to other small departments around here. I know it's not a top priority, but again, I just wanted it on the list so you guys were knowledgeable on it.
Yeah, no. Dollar figure,
Again, that's...
ammunition's gone up so much, I just want
I've provided Officer Miller with some of my own personal ammunition that he's using right now, so that's, I would say, on the lower end of the priority list as far as looking into the Explorer right now, and I'm not sure what our funding is for what we can and can't purchase and stuff like that. So it'll be up to you guys on what we can move forward with and what we can't. So.
But to get up to that maybe minimum or safe level, what are we talking about spending? What kind of budget money do we need to look at?
You're probably looking at a few $100s. As far as my list here, that's everything I think I've covered. I don't know if you guys had any questions for me about it.
Why don't you talk to us real quickly about, the next 3 or 4 months and kind of your schedule and Justin's going to the academy and then how we're going to feel.
As far as the scheduling, we'll implement what we had with myself and Chief Smith. We will continue to work our normal night shifts, but we'll be doing the day call for the nights that we work. You'll do the day call on that. Officer Miller goes to the academy September 9th, so we'll have to make adjustments if we get to that point and we don't have a new chief at that time. We'll have to start filling slots with other officers throughout the county. So that's as far as that, it should run rather smoothly because I did it for about 10 months with myself and Chief Smith, so it shouldn't be a problem.
Other questions? Here, Dennis, here's yours.
As far as that last sheet with the electrical engineering company, on your last page, you will see a number I've written in above the initial one, and that would be the final cost for outfitting the vehicle. As far as lights, transferring all installation costs, all that stuff.
Other questions for Officer Graber?
What was the time frame on some of these things? Obviously, I was kind of moving around through different items. The vehicle is, the Explorer we have right now is kind of on its last leg. The car's not, that's the only four-wheel drive we have, then it's the Explorer at this point in time. Would this vehicle be a four-wheel drive or?
Yes, this would be a four-wheel drive truck, and the Explorer is having, like I said, some issues, some transmission issues, stuff like that. I didn't mention in there the trade-in values. Woodhouse was willing to give us $6,000 for the trade-in on it, and that's incorporated within the pricing on there. And Sid Dillon was willing to give us $5,000. I had recommended to go through Woodhouse just because that's the company we've always used as far as police vehicles, and we have pretty good connection with the main fleet manager over there as far as getting everything taken care of.
I know that we put away a little money every budget for a new police car. And I had Maryland check quick, and I believe we're right around $8,500 what we have in our savings account. So we're a little lighter than we normally are. Usually we have pretty much most of it in that savings account to write a check and pay cash for it. So we're going to have to, take a look at the budget and look and see, if this is a top priority, where would we get the additional funds to make up the difference there? I think that first and foremost, when I was talking with Kyle and Justin, just wanted to make sure that transitioning from Chief Smith it was as smooth as possible. Secondly, we had the coverage that was necessary for our community, and they felt comfortable with it, and I think that they do. They've had, obviously, in a small town, experience with these condensed schedules. Wanted to make sure that we had the academy, all the paperwork for the academy, and which we do for Justin. So everything's taken care of there. And we double checked, we don't have the 2014 STEP program, so we need to get the paperwork filed for the 2014 STEP program. And the other comment he made was around the cameras, which are in the cars but not working appropriately. And so, yeah, if we have them, they need to work. So we're going to go ahead and get them working. So what I would recommend is between now and the next council meeting, we'll put on the council meeting to discuss and approve, and let's have a police committee meeting, and let's make a recommendation to the whole council to react to. Agenda item 14 is approved resolution 13-16. It's providing for reduction of interest rate for sewer revenue bond. And that's what we discussed at our last meeting.
I'll gladly make a motion to pass resolution 13-16, reducing the interest rate on the sewer revenue bond.
Do we have a second?
I'll second it.
Well, let me read resolution number 13-16. It's a resolution providing for reduction of interest rate for sewer revenue bond. Whereas $1,257,000 sewer revenue bond dated April 26, 2001 was issued to the Iowa Finance Authority by the City of Logan, Iowa in connection with a certain loan and disbursement agreement in pursuant to a resolution passed and approved on February 8, 2001 in order to pay costs of constructing improvements and extensions to the municipal sanitary sewer system of the city. And whereas pursuant to the issuance resolution, the bond was scheduled to bear interest rate of 4.3%, and pursuant to a resolution passed on March 7th, 2011, the interest rate was reduced to 3.0%. Whereas the lender has reduced the interest rate on the bond to 1.75%, such reduction to be calculated from June 1st, 2013. Whereas it is now necessary for the City Council to take action to approve the interest rate reduction. Now therefore be it, and it is hereby resolved and ordered by the City Council of the City of Logan, Iowa as follows. Section 1. The issuance resolution and all documents related to the issuance of the bond are hereby amended to reflect the reduction in the interest rate from 3% to 1.75%. From and after June 1st, 2013, the bond shall bear interest at 1.75. Section 2. The mayor and city clerk are hereby authorized to take such actions to execute such documents with the advice of bond counsel as may be necessary to carry out the purposes of this resolution. And Section 3. All resolutions or orders or parts thereof, to the extent the same may be in conflict herewithin, are hereby repealed. Passed and approved on July 8th, 2013. Any comments or other questions? It's really a good thing. So, if I remember right, it's like $33,000, $34,000 it saves us over the period of the term. If not, we'll vote. Councilmember Lefebvre?
Aye.
Clark?
Aye.
Johnson?
Aye.
Crum?
Aye.
I approve as well. Motion carries. Agenda item 15 is City Administrator Report. I'll start, and then Skip, could you put this on here? So it's you, Vicki Schroeder, and we've introduced her once before. And as you know, we as a council don't necessarily always agree on things, and this is one of the things that we don't agree on. Not that Vicki isn't a wonderful quality person, it's just in what maybe she's qualified for and what role she should be in. If you remember in, not the special meeting, but the meeting before that, and then question in the special meeting, I as Mayor Pro Tem vetoed the two resolutions to pay and then to back pay Vicki's role in Vicki. I did that based on an opinion from the Iowa League of Cities. And I wanted to read something here I have been in constant contact with them, and I got this dated June 28th, which was a Friday ago, and it said, first of all, and this is from Mickey Shields of the Iowa League, and it says, first of all, I sincerely apologize for any confusion regarding our opinions. Our initial reaction was that Mayor Pro Tem assumed the duties of the mayor, which would include potentially vetoing a resolution or ordinance. However, the more we thought about the veto question, the more we began to doubt that opinion. Bruce Bergman, their chief counsel, then checked with some of the veteran colleagues who felt that the Iowa law generally does not allow elected officials to vote on something and then later have the veto power. That is how we came back with a different opinion. Again, I apologize for that. As for your second question, which basically I said, what do we do now as a council and as a community? It's pretty difficult to say what should happen now. We're in the vague area of the law as the state code does not provide enough direction, and we have not been able to find any court cases that answers this question. Typically, a city would go with a legal opinion from its attorney to determine how to proceed. With that in mind, it might be best for the city attorney to issue an official opinion on this matter and use that for the time being. If anyone feels that the opinion is wrong, they would be free to take it to court for a ruling from a judge. Unfortunately, that might be the only way to get a definitive answer to this question. I just want to add that I appreciate your patience with this matter. This certainly ranks as one of the more challenging questions and one without a clear answer that's been asked in my 5 years at the league. Please let me know if you have any other questions. So we did go out, the council did, and they got an opinion from our city attorney. And the city attorney basically, his opinion was that the mayor pro tem cannot veto. And so the mayor did not sign the resolution. And per our code or ordinance, when the mayor doesn't sign and doesn't veto or take any action within 14 days, the resolution's passed. And so Vicki is here tonight as those two resolutions have now passed.
Vicki, how was your first day?
Basically, I just want to say thank you to Marilyn for making a very amiable day. There was a lot of confusion for both of us when I first stepped into the office this morning. There were some limitations put on both of us for what I would be allowed to do and what I could not do, and I think that we worked very, very well together, and I look forward to working with her in the future.
Thank you, Vicki.
Limitations, were you allowed access to your office? Can we rectify that?
Not until we get the computer image or secure. We have to, per our attorney, per the lawsuit that we have to get everything backed up on that computer. So we can't touch it until then. And so we've gotten the firewalls built appropriately, and we have to have somebody come in and now, they call it image it. And once that's done, then yes.
All right. My understanding is we have that backed up, and we've had a service that has backed that up, and we're in the process of gaining access to that.
I don't know that, and our attorneys wrote us a letter and said that it needed to be done. So I have to follow the attorney, since we're in a lawsuit, tell us what we're doing.
Our backup was canceled.
I understand. We're working to restore that.
Right. So we just need to get it backed up, per our attorney's advice.
We've accessed that computer on numerous occasions, though, so what's different now with moving forward in all the applications that we're constantly working on in there?
I am just going through the attorney's advice that he sent us the letter on. So we just need to get it backed up. The other item is that, and I had Marilyn send this out, that it came back to us on the reference checks from Chief Smith. And so we have to have those back because this particular position has to be bonded, and we have to have that to be bonded.
Have we done the others on that? Do we have a file that we've done those background checks on?
I would have to check, but yeah.
Okay. Well, I make a motion that she be allowed access to her office and begin working in the capacity that she's been appointed to.
Well, Skip, I have to protect the city. We're in a lawsuit. Our attorney said, do not allow anybody access until we get it officially backed up. Once we get it backed up and give that to him, then we can certainly give her access to that computer. We're in a lawsuit. The city's in a lawsuit. You three individually are in a lawsuit against us. And I think we need to really kind of do what we're asked to do.
What do you need in there for?
All right, I understand. Let me propose this motion then. We've kind of got your explanation for tonight on the events that took place, and I appreciate that. It's very forthcoming and delineating the events. The motion I'd like to make, and I've got this written out, so I'll give this to you, Marilyn, to have a copy of, and Mary, I'll present a copy to you as well. On behalf of the City Council of Logan, I'd like to make a motion to instruct the city attorney that he shall file a declaration of judgment action against Mike Fouch, Mayor Pro Tem, confirming the validity of Resolution 13-12 and 1313 as passed by the City Council on 6/24/13 in the light of the purported veto by Mayor Pro Tem. B, the power/limitation of Mayor Pro Tem to veto Resolution 13-12 and 13-13. And C, the Mayor Pro Tem's interference with officers and or employees carrying out their duties. 2, on behalf of the City of Logan, the City Attorney shall file a writ of mandamus against Mike Fouch, Mayor Pro Tem, to allow and grant Vicki Schroeder possession of the City Administrator's office pursuant to passage of motion on the motion on 2/18/13 and passage of Resolution 13-12 on 6/24/13. B, to pay her wage as set by Resolution 13-12 and to authorize payment as outlined in Resolution 13-13. And also C, to prohibit Mayor Pro Tem from interference with Vicki Schroeder as City Administrator.
Is that an agenda item?
I'll second it.
My word. All hail Bruce Carey.
This would be an email from Aaron Rodenberg, the city attorney, dated Thursday, May 9th. And basically, what it says is under section 372.14, the mayor has the authority to supervise all city officers and departments. And so as I look at that, we have to, the mayor supervises and determines what work gets done by whom, is how I interpret that. But I would be open for additional interpretations from Aaron on that. But that's what we had received from him. And secondly, I would be happy to put this on the agenda for next council meeting, but it's not on the agenda tonight. So we can't vote and make a motion on something that's not on the agenda.
I disagree, we can, and I'd like to be called for a vote.
Well, I don't know, again, I've been confronted by this before, but it's not on the agenda, so I don't know how we can vote on something that's not on the agenda.
The city administrator is on the agenda. Her report, which you admitted she's not being allowed access to her office. You have an explanation as to why. Mm-hmm. This motion will address 2 of the points you made. 1, you still believe that there's a somewhat ambiguity about the law and what you can and can't do and where we go from here. Mm-hmm. And this basically would clear that up. Take the politics out of it, take it, we'd get a decision on it, and we can move forward. Mm-hmm. This really would settle that and wrap this up. In the meantime, though, it sounds like we're still preventing Vicki from doing her job.
So we have 2 resolutions that actually, as I self-admitted, those have now passed. So your resolution of paying her back pay has passed. And your resolution of paying her the $15 an hour has passed.
I understand.
That's passed. So those are out there. Now the other question for me is I have a letter from an attorney that basically says do not allow access for people on the computer until this happens. So, if you were in my shoes, what would you do?
He fired the attorney.
Please keep it down.
We've got a lot of comments from the
I know.
crowd here. Appreciate it.
Yeah. I told him to keep it down, yeah.
Thank you.
And on my mayor pro tem, when I talk about my comments here, there's nothing that you vote on in the comments. Those are just informational purposes, and again, we got that opinion from Aaron as well on the mayor pro tem comments or the city clerk comments or administrator comments. It's updating us on progress towards things. It's not stuff you bury in there to vote on.
Mike, I'm sorry, we're going to disagree on this. I believe this is a totally appropriate opportunity to do this, to resolve this issue. We're here today, and we've got a report that she's not allowed access. You know, we still have some question about really where these things stand and where we go from here. This will clear this up. I ask that you call a vote.
I'm not going to call a vote. I don't think it's appropriate. It's not on the agenda. That's my point. If it's on the agenda, I'd call a vote. I'm not afraid or back down from this. I mean, if you three, if that's fine, I would call it for a vote if it was on the agenda. That's my whole point in this.
Well, again, I believe it's a waste of time to call a special meeting to pass this one resolution when it's totally appropriate to do it right now.
I think it has to be on the agenda.
It is on the agenda.
There's nothing on the agenda. It says city administrator report. It doesn't say anything about decisions being reached or votes or anything like that. We've never voted in a city administrator or city clerk comments.
We can make a motion at any point in time regarding emergent issues where there's not somebody prevented from doing their job.
Right.
She can still do
Please.
her job. She can still learn how to do water reports and everything else for Maryland without being in that room.
Well, I agree with you, Denny. I think there's plenty.
She can learn a whole lot in 2 weeks or 3 weeks by the time we have the next meeting. She don't need, you got the 3 votes. You got the 3 votes. So put it on the agenda for next meeting. You're gonna pass it anyway, so put it on there.
I don't think we should have to wait. I would disagree.
So, okay, the job descriptions. Vicky is doing the clerks, and I'm doing the deputy clerks, right? Who's training Vicky?
Will assist with that. She will obviously maybe get some additional assistance.
It says nothing in the deputy clerk's job description to train the clerk.
Please keep it down, please. I don't think it's appropriate to vote on it, so I'm not going to call for a vote because it's not on the agenda. And that's why it's not on the agenda. Agenda item 16 is Mayor Pro. What I already commented was what I was going to comment in my Mayor Pro Tem comments. I do know that we have something else that Scott wanted to bring up on the water and sewer. So I'm going to end my Mayor Pro Tem comments. And before citizens' questions and comments, we have 2 things. We have the claims register, and Scott wanted to talk to us as a council as well.
I didn't get a chance to get this on the agenda, but this is something that we need to look at. I think Marilyn got you a copy of a couple quotes. We had our main lift station, one of our pumps went out here a couple weeks ago. It just started pumping less and less. They pump about 700 gallon a minute, and pretty soon it was 400, 300, 200, and ran one day long enough that it kicked the breaker out, so I shut it down and had electric years old. And
Expectancy on them.
15 years maybe at the most. These chopper pumps are a little bit more demanding than a regular pump. The new one we put in is not a chopper pump, but this is the original. That's what they put in when they first built it with these. Basically, it grinds up all the solids, plastics, papers, and things like that before it pumps it out. At the time when they designed that, they thought that was the way to go. They're telling us now we really don't need those, but I think we're $10,000 difference. We should just, the motor's fine. So it's gonna have new impellers, new cutter bars, new seals, all that kind of stuff. And I believe that'd be the way to go. If we can get another 10, 12 years out of it being rehabbed, why? Save us $10,000.
Extend the life on it.
Oh, yeah. Because it'll be all, the impeller and the cutter bars and everything are what pumps your wastewater. That'll all be new, so it'll basically be almost like a new pump. I mean, the motor's still gonna have the hours on it, but it checked out fine. So, you know, it's not pulling too many amps, got a good ground and everything, so. I just wanted to let you know that this is something that we have to do. I don't like to spend $14,000 without you guys knowing about it, so I recommend that we just go ahead and have them repair that pump and bring it back and put it in, so.
And how soon can they do it, by the way?
I will call them tomorrow and they'll get on it. The new one would be over 10 weeks out if we ordered a new one, so I believe it'll be sooner than that on a repair. They already have it torn apart. Just have to put the new parts in it, get it back to us. So I'd say, you know, no less than a month. But we're okay with the other pump. It pumps fine as long as it doesn't go down, but which is highly unlikely. But just wanted to let you know that we're gonna have to spend a little money. So.
Yeah, we can pass it, or we can just not even, I mean, he's just letting us know it's less than 25,000. Unless somebody has a problem with doing that.
No.
Okay. Claims register?
I'll make a motion, we,
Okay, we're back to the consent agenda.
consent agenda, the claims piece was the only item, and claims register was the only item outstanding.
That's correct. Okay.
I'll second it.
Got a motion and a second to approve tonight's claims register in the consent agenda. Any further comments or questions? Claims register and cash report. Okay. Councilmember LaFever?
Aye.
Clark?
Aye.
Johnson?
Aye.
Crum?
Aye.
And I approve as well. Last agenda item is to adjourn.
Make the motion to adjourn.
We have a second. Councilmember LaFever?
Aye.
Clark?
Aye.
Johnson? Crum?
Aye.
And I approve as well. Tonight's meeting has been adjourned.